today. Thank you everybody for joining. Today's webinar hosted by SecureVideo. We're going to talk about how to supplement your EHR. There's various features within SecureVideo that we believe that can augment EHRs that you're using today. First, I'm Josh Hood. I'm an account executive at SecureVideo. Also joining me, I have Kate Brandis, our VP of Operations, and Michelle Dong, our Director of Product. So what we'll cover today, first we wanted to go through a couple trends that we're seeing within virtual care. We'll talk through the core components of EHRs that most of you are probably using today, and then any gaps that we're seeing within telehealth, and would also love at the end, to hear any other gaps that you're experiencing. We'll go over what is SecureVideo for those who aren't familiar, and then we'll talk through just various functionality and features that SecureVideo has to enhance patient experience. And then at the last section, we'll talk about integrating with EHR via SecureVideo. And like I mentioned before, we'd love to hear your challenges at the end of the presentation, but also feel free to ask questions throughout. We'll be monitoring the chat and be able to answer anything you have. So to kick things off, really based on a lot of our research and customers we've been talking to, we found these key trends for virtual care. Right now, they're estimating around 25% of patients are using telehealth. This is expected to expand up to 50% by 2030. Before COVID, so 2019, 2020, this number was about 5%. So we're seeing obviously increasing growth there. We've seen a huge increase in deployment of behavioral health services across the United States, which telehealth is great for. A lot of group sessions. We're seeing that increasing throughout the country. We're seeing a need for EHRs to be able to integrate with video conferencing. Maybe they haven't built one themselves, or it's lacking certain things. They're looking for ways to integrate with video conferencing solutions. And then a couple of barriers we're seeing, really the main barriers with virtual care are internet connectivity. So rural areas that are maybe not have great high-speed internet, and then also just limited services provided within telehealth overall. And then obviously a big one, cybersecurity, a huge focus for not only the healthcare organizations, but also patients, not really wanting to, potentially join a telehealth session. They may feel uncomfortable about their, being on video and that being out on the web. And then also from the patient side, we're seeing a huge prioritization of ease of use. So, elderly population, they're looking for an easy way to connect with their provider. And we're seeing that across our customers and really within our research. So as we look at just an EHR that, probably most of you are using today, the larger EHRs, there's really some core components that they do really well. First of all, patient management. So the patient portal, most of them have now, that really facilitates the capture, storage, retrieval of patient information. Then charting, which providers would be doing within the EHR, any type of pain medication order entry management that's done within EHRs, secure messaging, and then obviously billing and reporting. We really see these as the core components of EHRs. When we look at virtual care within them, we've really seen this to be somewhat of an afterthought. So they've built out an EHR with all these great components, and then they see the need for telehealth and they try to bolt that on somehow or build something that's maybe not fully functional or doesn't have a great patient experience. So we're seeing some missing key functionality within EHRs for virtual care. We're also seeing a lot of just random issues with audio and video, whether that's on the patient side or on the EHR side. Group sessions, so a lot of EHRs that maybe can just have the one-on-one interaction via video conference. Really stepping into that behavioral health and trying to have group sessions can be a challenge, or just not there at all. And then some complex use cases that we're also seeing that, really EHRs aren't equipped to handle, which kind of leads also to a lack of, configuration options from the EHR. But backing up a little bit, just for those of you who don't know, like I mentioned, we're SecureVideo. We solely focus on telehealth. We're a cloud-based telehealth platform. We were founded in 2012 by a physician and a developer, actually. So really that workflow of a provider working, wanting to meet with the patient via a telehealth session We've really built that out exactly how a physician would want that to be built out. We are HIPAA compliant and high trust certified, and we have a lot of different configuration options. So small clinics or the solo practices are equipped to, we're equipped to work with, and then also up to large hospital systems. We have a wide variety of customers. And then, as we'll talk about later, we do allow API access for integration with EHRs, which is obviously a big need in the market. And then we also have 24/7 support, and this is for patients and providers, which I believe is huge because we do have a lot of patients reaching out with technical issues, and our team's willing and able to help, and we don't have to wait. You know, they don't have to reach out to the provider or the hospital for help. SecureVideo is able to help. Some in-session functionality within SecureVideo. So we do have breakout room capabilities. One of our video engines, as we'll talk about a little bit, is Zoom. So there is breakout room capabilities. Also within Zoom, there's transcription services, which is often helpful in the healthcare field. We are multi-device compatible. So whether a patient's on their laptop, tablet, cell phone, they're able to use our platform. And our group sessions, we have the ability to host up to 300 participants in a group session, which, as we were talking about earlier, behavioral health, this is a huge need there. Another key feature there is the display name feature. So patients can join a group session, not have their name displayed to other participants within the session. So that's some in-session functionality. As we look at the patient experience overall, a key thing here is it's browser-based for the patient. So there's no app they have to go download, you know, on their phone or tablet or laptop. They can join from browser. There's automatic invites and reminders sent out for all patients. So provider doesn't have to worry about, you know, did they get this invite or subsequent reminder. Those are automatically sent out through SecureVideo. And then we also have e-documents where patients can submit and sign, you know, things like consent forms or insurance information, things like that. They can have those built out on the account and have patients submit those via SecureVideo. Very simple and easy to use process there. And then, as I mentioned earlier, a big key we believe at SecureVideo is having technical support for patients, that we handle those issues, those chats or phone calls, and we leave the healthcare providers to do what they do. All right, I'm going to pass it over to Kate to talk a little bit more about some features within SecureVideo.
Yeah, thanks, Josh. So as Josh has been talking about, what we're finding is that there are some features that, may be lacking within an EHR's built-in telehealth solution, and that's where SecureVideo can really supplement what you may be using today. One of the different things about SecureVideo that we've seen from anything out there in the market is the ability to integrate multiple video engines into our service. So as it stands today, SecureVideo has what we call dual video engine, or two different video engines available. One of those options is to hold your telehealth sessions in Zoom. The other one is called OneClick, and that's our proprietary solution that utilizes just a browser-based connection between the provider and patient. So in developing that, it was from an understanding that telehealth is not a one-size-fits-all approach. There are many different ways that telehealth is used, many different situations that either different features may be utilized, or the provider and patient just may be coming from an entirely different situation or place. So we wanted to give as many options as possible to our customers to allow them to have a great solution available no matter what the use case is. So why, you may be asking, would I use one over the other? So just as a couple examples, Zoom is the installed version of Zoom, just like we're meeting in, similar to like we're meeting in this Zoom webinar. Provider and patient could meet in the Zoom platform. They would have access to all of Zoom's really great functionality within the platform. Josh mentioned a couple earlier, one being just the closed captioning service, or maybe you need to utilize breakout rooms for larger group sessions. The whiteboard feature. Zoom has some really well-developed features available, and we want to make sure that's available to our customers if that's the best situation for them. The other being the one-click solution, that's where you join from in browser. This could be a situation where it's really just more of a maybe one-on-one interaction between doctor and patient. Patient may need the easiest possible method to join the session, and in our minds, that's the one-click solution. They get the link to join the session and click on it, and it takes them right into the session right in their browser. So having those options makes it possible for providers to navigate in any challenges related to telehealth. One of those we mentioned here is transition with little disruption. What we mean by that is when a session is scheduled in Secure Video, there's an indicator right on your dashboard that shows that either this is a Zoom or a one-click session. If the provider sees that there's a situation where that needs to change or patient is having trouble joining, they can simply drop down, change to the other video engine, and there's nothing else that they need to do. They don't have to cancel the session, try to reschedule it, send out a new notification through a different platform. Secure Video simply handles that by updating on the back end the method by which that patient would join. So they're clicking the same link, they would just be taken into, for example, one click instead of Zoom. So this is really useful in a situation where there may be a blip in the road. You're getting ready as a provider to join a telehealth session. You're having some trouble, your patient's having some trouble. It gives you another option to change over to something else on the fly so that, avoiding that possible worst case scenario of, oh, sorry, we're not able to complete this session. So again, the idea being that, the reschedule is just the last possible thing that you'd want to do. And then the last point here is the automatic failover option. So we're seeing this a lot with larger healthcare organizations where IT departments are being faced with a task of putting redundancies in place for everything. And that's just part of some disaster recovery plans or, just operational, just things that they're being tasked with doing. So Secure Video has addressed that by building in an automatic failover from one video engine to the other. So in the event that, let's just say, worst case scenario, there's a widespread outage for Zoom, we would have the ability on the back end on Secure Video to transition all the scheduled sessions over to one click just right away. And this would cause no disruption to the patients, probably just very little disruption to the providers other than it may be not the video engine that you're used to seeing all the time, but at least it gives you a way to connect with the patient rather than just waiting for, who knows how long for, the service to be available again. So Secure Video is trying to take that burden off of our customers by implementing redundancies on our part so that you don't have to. All right. Next, we wanted to touch on interpretation services. This is another feature that we see may be needed and may not always be available through the EHR's built-in telehealth solution. Interpretation services, obviously the idea here is to expand access to patients that you may not otherwise be able to serve by providing a live on-demand language interpreter. So as I know, many hospitals are working hard to expand their services that are available through telehealth. Interpretation services may be exactly what's needed to help you reach new patient populations or serve, let's say, even hard of hearing. You could use American Sign Language as one of the language options. So we're very proud to be able to offer this feature. The way it works is that you'll see on the screenshot there, as a session is scheduled on the user's dashboard, there's a just call interpreter now button that's available. Clicking that brings up the second screenshot, which shows just a list of languages that you can pull down, select your language, and then the process just starts automatically by connecting you with a live interpreter within minutes. The system, the dashboard, shows you where you are in that process. So you'll be able to see as soon as your interpreter joins and then can join the session with that patient. This is available with 240 spoken languages, and then I mentioned American Sign Language as well. And this is based on a simple per minute utility billing model. So this is one of those features that within Secure Video, it's just billed based on usage. So if you want to have it available in case you need it, it's there. And at the end of the month, we just tabulate how many minutes have been used in that month and bill you accordingly through Secure Video's invoice. All right, I'll pause there because I've gone over now two pretty key features. Any questions so far? I just wanted to give anybody the opportunity to jump in and ask a question. Oh, good, okay. We've got one in the Q&A. Where can I find the list of languages? I'm looking to see if you have Vietnamese in addition to the ones shown in the screenshot. Yes, thank you. Yes, Vietnamese is one of the languages available. We do have support documentation that includes the full list. Oh, I see Michelle typing. She must be probably going to drop a link in the Q&A there. So hopefully that will answer your question. But yes, Vietnamese is one of the languages supported. Thanks for the question. Oh, there's another one. Okay, can I add the interpreter feature for just some of my providers? Not everyone will need it. Oh, that's a great question. Yes. So interpreter services is just one example of many of the features in Secure Video that can be configured per user. Because a lot of providers, again, depending on their department, depending on what area of practice they're in, may have different needs when it comes to what kind of telehealth sessions they're holding. And you may not want to, make a service that's available to, utility billing to be available to everyone in the organization. So yes, the short answer is yes, it can be enabled for just specific users within your organization. Thank you. Good question. All right. Let's see. We'll go on now. I think there's one more feature I wanted to cover, and that was the masked calling feature. This is another one too that we find, isn't always available through an EHR. This is a feature that allows you to make outgoing calls from the Secure Video dashboard, just using voice over IP service. So using your own computer's speakers and microphone, or for example, if you are a physician working from a remote location, you're not necessarily in your office with your office phone. You may want to call your patient and not have them see either a personal phone number or personal cell phone number, for example. So masked calling is a feature that allows you to set up your office line as the main number. You do that through a quick verification process through Secure Video. And then you can place outbound calls using this masked calling feature through your Secure Video account. So making a phone call through Secure Video is as easy as clicking the masked call button. You'll see on the screen, there's an arrow pointing to that masked call button. That brings up just a simple interface where you can punch in a phone number for your patient. Or if you have a scheduled telehealth session, as you'll see lower down in the screenshot, there is a masked call button beneath each participant in the session. So if you click it from there, it automatically dials based on that contact information for that patient. So it's a quick way to make a phone call, an outbound phone call. And then when your patient receives the call on their caller ID, they're seeing, instead of your own personal information, they're seeing the verified phone number. So your practice's front desk, for example. So one, it makes it more likely they'll actually answer the call because they might recognize the number. And then two, it helps you either as a physician or as a medical staff to keep your own personal information private.
Oh, we have one more question that might
Oh.
be better answered live.
Great. Oh, how does pricing work? Yeah. So pricing for Secure Video is based on a license per user. And a license in Secure Video is a host of telehealth sessions or an account administrator. So those two roles qualify for a license. We are, as Josh mentioned in one of the very early slides, suitable for even the smallest healthcare practice all the way up to large hospital systems and healthcare. So at its simplest form, our pricing is based on a subscription model where you go to our website, sign up for an account, and you can be up and running and holding telehealth sessions in minutes. For a larger enterprise scale account, typically you're going to want to work with us on pricing because number one, volume discounts may be applicable here. And two, we can work with you on a project management basis, really thinking through what your specific needs are based on the number of users you have, the different departments that you're trying to support. We just want to talk through what would work best for your organization as far as that license and that pricing model. So pretty flexible in terms of that. And we just ask that you contact us. We can initiate a discovery conversation and just see how we can make it work together. But I guess, I probably didn't answer the base license fee. If it's just a subscription base, is $50 per month per license. And all that information can be found on our website too. Hopefully that helps answer the question. Okay, I think I will turn it over now to Michelle Dong, our Director of Product. Michelle is going to touch a little bit on some of the integration capabilities with your EHR to make it a little easier to use both. So, Michelle?
Thanks, Kate. So with the integration, there are a couple of ways that we can go about doing it. One, if you're only looking for like integration on scheduling, where anytime you create, reschedule, or schedule a session in your EHR, then that appointment automatically gets created, rescheduled, or canceled in Secure Video without doing anything manually. This way can be handled like generally quickly using just HL7, where like someone on, we would work with a member of your team to configure HL7 messages. And yeah, just it's a quick stand up generally. The second way is using our API, which requires a little bit of development work, but it can be used not just for scheduling, but also creating and managing users, enabling single sign-on, um, integrating like our e-document feature with your EHR so that like when someone fills out certain fields, like in our system, that field data can get mapped to specific fields in your EHR records. Um, and like other things that may require more information to move, not just from your EHR to us, but from us to your EHR. So yeah, but also happy to take questions on that. Um, oh, which EHRs can you integrate with? Um, so we know among our customers, we've done like some of our customers have done NextGen, Cerner, eClinicalWorks. The problem is though we don't always know like what our customers are using because as soon as we enable the API key for them, if they don't have any questions, we don't actually know like uh, how they're set up. But like it's in general like it's a RESTful API, so it's a standardized system. If the other EHR and a lot of the larger EHRs allow this, um, and pretty much every EHR has HL7 support. So yeah, it's not a single one. It really depends on what our customers are using, and we support them however we can. Um, yeah, if no other questions on integration. Oh, thank you. I'll pass this back over to Josh for a wrap up.
Awesome. Thanks, Michelle. Thanks, Kate. Yeah, at this point, really just want to hear from you all if you have additional questions. I know we've answered some live throughout the presentation. So if you have questions specific, to Secure Video or any maybe challenges you're facing with your, your virtual care within EHR, we'd love to hear about them. Looks like we got
question.
one come through. Yeah.
Oh, yeah. Okay. So someone asked, how many healthcare practices do you work with now? Basically, the short answer to that is around 1,800 different practices that we work with now. But that's a little tough to answer because, as I mentioned before, we're able to support, small all the way up to large practices. Some of them may have just one or two providers on the account. So of those 1,800, it could be that there are several hundred users, within that account. So hundreds more as far in terms of who's actually using the software today. But in terms of just the number of healthcare practices that we work with, we're hovering at around 1,800 currently. Hope that helps.
Oh, one more question. A lot of my patients are familiar with Zoom, and I've had good experiences with that, but some older folks have had trouble. Is this where I would use one click? And I would also say like, yes, you can. One click is like generally, you just click yes, and give like the user would be prompted to give permission to access their camera and their microphone. And then, just click yes, and then they can see each other. I do also want to note that patients can join using Zoom's browser version as well. Zoom's browser version has like a little bit more limited functionality around screen sharing and like annotations, but for a quick join, they can both work. But, yeah,
I may also add too that, yeah, I was just going to add, if there is a situation where some of the patients are just having trouble, a lot of times that the onus of that falls to the healthcare provider or the medical staff, and that's what we're trying to avoid by allowing 24/7 support. What we always encourage our customers to do is to send the patients directly to us. When someone calls our US-based support line, they are getting an agent within just a few minutes, someone who is their main goal is to help them join that telehealth session as quickly as possible. So they're going to troubleshoot right away what the challenge is, walk them through if it's just the process of opening Zoom, or if they get stuck on allowing camera and microphone permission, anything that may be kind of our more common technical questions from a patient population that may just not be as tech savvy. They're very well trained to handle those. And that's what we always recommend is, don't let it be your staff that's trying to help solve those issues. That's what we're here for. And that's part of the service through Secure Video. Thank you. Got a great presentation. Thank you, Comment. Appreciate that.
All right. I wanted to thank everybody for attending. Yeah, if you do have additional questions after, support@SecureVideo.com, or feel free to reach out to me. It's jhood@SecureVideo.com. I'm happy to help. Thanks, everybody.
Excellent.
Thank you,
Thanks.
everyone.
Bye.